Medicine, and we're talking about medication this afternoon,
Right.
and just how many adults are taking medication.
Based on the CDC study in 2012, approximately 49% of patients are taking at least one medication, and more than 10% of people are taking more than 5 medications. So that's quite a bit of medications that you are taking.
When you're taking 5 different medications, that's a lot to juggle.
Right. And it's important for you to understand that with each medication that we add, there's a higher risk of you having a medication interaction between one of the other medications. As medicines become more specialized, the more people you're seeing a heart specialist, you're seeing a lung specialist. And so sometimes all the medication that they're prescribing is not really communicated to one another. So it's always important for you yourself to know what medication that you are on, how much you're taking, and why you're taking it. Especially when you have to go for an emergency to the emergency room. Most of the patients don't know what they're taking and why they're taking it, and it puts a higher burden on the emergency room physician to figure out what's going on, because approximately 5% of the time the reason they're there is because of medication interaction. And so that's quite a bit.
Is there something they should be carrying if for some reason they're unconscious and getting emergency help, or as long as they know it, that will be beneficial?
If they're carrying something like a card that has all their medications updated, that would be excellent. There's applications nowadays on smartphones that you can that you can download, and you can put all the medications that you have on there and the doses. As long as they have some sort of list in their wallets or anywhere on them, that usually is good, especially where you keep your insurance card or something along those lines, where people are going to be looking anyways, or your identity. That would be a good place to keep all your medications.
So they shouldn't just know what they're taking, but how much and why, like you said,
right.
For when they're seeing different specialists, and then again in emergencies.
And this not only includes all the prescription medications, but also if you take anything over the counter, ibuprofen, Tylenol. Make sure you keep a record of how much you're taking. Sometimes people take a little bit too much, not enough, and that causes interactions. Any vitamins that you're taking, any herbal supplements that you're taking. Your body only has 2 ways of metabolizing your medication, which is your liver and your kidneys. And so once we're putting some medication in your body and they're getting busy, it's not going to allow the other medications to really do their effect.
All right, some important information. Thank you for joining us this afternoon.